head of department, our Dr. Lee Sibu, our guest on the board of visitors, even though not all can come, but we really appreciate if you can make yourself to come. We really appreciate that. And also our guest, also from the welfare department, and all the staff. A very good morning again. Salam sejahtera, salam satu Malaysia. I'm very pleased that this function is organized. When Mr. Adi comes to see me and inform me that ENT is going to organize a hearing week, I said that is really great. That is really great. We should be moving into community. I think this hearing week is not just for the hospital staff, but it's mainly for the community. That's why she suggested to him at the time they should do about hearing screening. Then we realized that we do not have enough resources to that. But ENT department has just taken up the challenge to actually do a targeted group for hearing screening this time, the RTM staff. So this week is organized with the objective to create awareness of common causes for hearing loss among children and also adults, and also to promote the behavior of early seeking treatment. That's why there's an RTM activities and all that going on to promote the early seeking treatment behavior. Hearing loss is actually one of the very common presentations of patients to us in the ENT, hearing loss and throat clinic in our setting. In fact, for a year, I think it is the most common. I just verified this now. But what cause? There are various causes. But despite the presentation to us, we still believe that there is still underdiagnosis of a large community, a large group that actually still not actually presenting or coming forward to present themselves to us for treatment. In fact, hearing loss affect, if you go to the poster afterwards, it will say, it tells you that certain data from overseas, it affects 1 to 2 in 1,000 newborn well babies. And for babies with risk factors, it's affecting around 1 in 50. Risk factors meaning to say babies who are born prematurely, the birth weight is less than 1.5 kilo, got any underlying abnormalities or there's some familiar hearing problems, or the mothers have some during the pregnancy infections, for example, or undergoing certain, or on any treatment. There are some. These are some of the categories where they say the baby are actually under risk. In fact, a study conducted at one hospital in Malaysia shows that 0.04% of the infants screened suffer from hearing loss. There is only a very confined study to one particular major hospital. The figure doesn't seem to be very alarming, but there is only for infants. If we look at how many infants that we have, I think, and the numbers that potentially be affected is going to be actually very huge. Adult, I believe, I don't have the data, but I believe that there are more, especially the age-related and other causes in hearing. They are just that not yet come forward. So hearing loss can be due to many causes. It can broadly categorize. It could be primary or it could be secondary. Primary, for example, congenital abnormalities, also infections within the middle ear or age-related. Or it could be secondary, such as drug-related, induced or work-related, chemical induced or noise or induced. Noise can be leisure noise or occupational related noise. Nowadays we have a lot of very high exposure of leisure noise, especially the Y generation. Yeah? But even the other generation also like a lot of very music, children music. I mean, music, as Dr. Lee has said, people love music. I've seen people jogging with music on also, because I usually go to the park and I see people jogging with this heavy boom 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 behind them, what is it? Then it's actually people jogging the music on. Yeah? So for among children, otitis media with diffusion, or we call it blue ear, is very common. In fact, studies done in the United States and Europe show that 50 to 80% of children have been affected by the age of 4 years old. That means they once have been affected by this problem. Close to 50 to 80% of children. But we do not have the Malaysian statistic. But of course, the prevalence usually declines beyond 6 years of age. Meaning to say, affects a younger group. And such a risk of having this otitis media diffusion, or in short we call OME, is increased with passive smoking, bottle feeding, or tends to affect the low socio-economic group, or those children with frequent upper respiratory tract infections and those exposed in a daycare center, for example. So the presentation can be very subtle. Dr. Lee just now mentioned that some people, we are on the music, on very loud, only they can hear, because they don't know that they have a hearing problem. For children, like OME, this problem, they don't present with pain. They don't cry. Usually we know that children have problems, they cry. Especially at a younger age. They don't know how to complain. They usually present with crying, but this group they don't. So it can be very subtle. So usually, because and that hearing problem usually is mild to moderate, it will not be so severe. Alright? So patient usually notice some problem only when the child behaves differently. Right? Or their academic development, they realize there's something wrong, they just cannot catch up in school. Right? Or they can't speak very well. And this problem, very common problem, has complications to the ear. So, in fact, many of these children, they will identify, the problem is identified at the very later, at 2 years old, 4 years old, in the very mild cases, only identified at 6 years old. So, we do see, I mean, if there is not identified and not treated, then we know that definitely it will contribute to the development of the child in terms of social interactions, in terms of the linguistic problems, and of course academic development. And if we look at academic developments, it will have potential impact. If we talk about economy, we have potential impact on the economy, either directly or indirectly. We may deny somebody, with the potential intellect, and because of the hearing problem, not addressed, they cannot develop up to their potential intellect. So is somebody who is very great, supposed to be, but because early treatment is not instituted, they are denied of that. They become handicapped instead. So it really causes unseen cost economically. In general, there is still a lack of awareness of occupational related hearing loss. I don't think we see a lot of people, workers coming to us with occupational related hearing. Not active screening. I think we don't really see active screening, except the group that we hospital is doing active screening is confined to health setting, our own staff in the health sector, in the public health. The foggers, the one with fogging machine, the mosquitoes one, because they're exposed to very high noise level. It is generally still lacking in awareness. And in fact, the use of hearing protective equipment is either not being considered by the employers. I often see there are certain levels they're handling certain equipment. Either it's a high vibration or very high noise level, but without having any protective equipment, without wearing. So it reflects on the employers. But of course, there's certain situation there also is workers also think that it's not important for we supply the equipment but refuse to wear it because it's just too bulky to wear or not comfortable to wear or too hot to wear, especially in climates like Malaysia. A lot of them feel that certain equipment is actually too hot to wear. Sometimes, even in the heli, we used to travel by helicopters. I mean, we are not VIPs, but we used to travel because for patients, we used to travel by helicopters. So sometimes even our own staff, when the propeller is the thing is on, the machine is on, they're still not putting on the earmuff, or before the helicopter actually completely off. When the moment it touches down, everybody just take off the earmuff. As if that, probably there is actually Sibu, or not just Sibu before, but it's a overall I observe. A lot of our own, even our own staff, even in the medical environment, in the medical setting, even our own staff don't think that is so important. So, let alone saying that there are many who are actually not exposed to that medical knowledge. Even hearing conservation programs to be in place for work with persistent noise exposure of more than 85 decibel. Age-related hearing loss is common. As I said, not many seeking treatment, as totally just not rightly pointed out. People just on the music louder. And in fact, there is still a taboo. According to our ENT team, they still think that people have a taboo of wearing the hearing aid. The taboo would say, the moment when we wear a hearing aid, it shows to people that we have some hearing problem. Correct? If you put something near your ear, then people say, oh, this fellow is either deaf or hearing problem. And a lot of the time, we don't like to face this fact, to acknowledge that we actually have a problem. Just like, it's the same, just like a lot of people, for orthopedics for example, they don't like to use crutches, or they don't like to use tongkat. The older group, they don't like to use the walking stick. They prefer not walking around compared to using a walking stick because they don't like people to know that they are handicapped in one way. So I hope that society in one day will be able to recognize, to be brave enough to face the reality of life. Of course, aging is aging process. Everybody, that is just part of life. And so that people will be more aware of a better quality of life. Of course, we can hear better. You can enjoy the music just like the Y generation. You can enjoy a lot of things. You can hear what people say. There is no miscommunication. There is no unnecessary anger. Because I realize that even those are age, a lot of times they feel angry because a lot of things is miscommunicated. Psychologically, not good for them. So I sincerely hope that our society, we will move towards facing the reality of life and working towards how to make life better quality. So that we can come forward when there's a problem with hearing, so that we can provide the service. At the moment, I think, let's say if a community in Sibu here really very aware of hearing problem and come forward, I think our ENT clinic will be very, very busy. Dr. Lee was saying, need more ENT specialists, more audiologists. That's why I asked, how many audiologists we need? Yeah? So that, but I think that is a good thing. I think our side, we are daring to face that challenge. We are daring to tell our higher authority that we need this and this, so that at the end of the day, we would like our community to be benefited and to live a better quality of life. Sibu Hospital has really improved on hearing loss assessment since 2008. So in 2010, there was actually a device for detection of hearing loss, especially among infants. We call it AAER. Right? So currently, with the limited resources that we have, we could only manage to do hearing screening for high-risk infants. We can't do for everybody. Like today, we can't do for all of you who are present here. So we hope in future we could really extend the screening for all the infants. We're working towards that. I'm asking our audiologists to prepare a proposal. We submit a ministry request that at least we start off with universal screening for hearing loss for the infant. So that treatment of hearing aids can be offered to infants within the first 3 to 6 months of child's life. The moment we delayed intervention, we are risking the child to become really deaf. The golden period, as I asked the reason, is 4 years, because the pathway is still developing for children during that period of time. So if there is no stimulus, then the whole pathway will not be developed. So they will be totally deaf. They'll be deaf. And because we don't do anything early in our life. So that is something that we will be working towards. And we don't mind if the public to come to us, load our clinics, then we'll screen for more stuff and more fun, so that the people in Sibu area, in the Razor Basin, will be benefited. So I really hope that through this hearing awareness program week, that community will be partially through this week to be more aware of it, and then I hope also the ENT team will continue the effort, not just this week, but I'm sure they will, to continue to create awareness of hearing, the importance of hearing among the community, either through radio or through other channels. Last but not least, I would like to thank once again for the team who actually headed by Dr. Lee, who actually made this week possible. It's starting, and it's starting for something that is better tomorrow.